to our Gold participants from around the world. Welcome to the Gold Lactation Online Conference for 2016. I'm Fiona Lang-Sharp, IBCLC Public Relations Manager and MC for Gold Lactation Online Conference. Well, welcome everyone. I get to sit down with Maya Bunik today. Thank you so much for joining us, Maya. It's great to have you.
I'm very honored to be presenting this year. Thanks so much.
So Maya is going to be our keynote presenter this year, and we are so excited. She has this amazing topic that she's going to be talking about, and it just seems like you're so passionate about it, Maya, and I'm going to let everyone know what the title presentation is. It's titled A Trifecta Approach to Supporting Breastfeeding. It's so much more than just the latch. Well, I think that says a lot there. We've been saying that for years, but now I want you to tell us a little bit more about this topic. And but before you get started on that, why don't you introduce yourself to our audience and tell us a little bit about yourself and your presentation.
Sure. I'm Maya Bunik, and I'm a general pediatrician in Denver, Colorado. And I am fortunate enough that I have been medical director of the primary care clinic where we see kids from age 0 to 21. And about 10 years ago, we got some grant funding to co-locate and integrate our mental health providers in our general pediatrics clinic. And with my strong interest in breastfeeding, it became clear that postpartum depression screening on mothers was one of the key first things that we needed to do in our clinic. And as time went on, that probably every breastfeeding mother could use a review of her postpartum depression score and just a touch base with our psychologist. And so we initially applied for some funding for this from Kellogg, and now it is part of our usual practice. And so as part of our breastfeeding management clinic, which I do with a lactation consultant, all of our mothers get sort of a debrief with our psychologist afterwards. And as part of my talk will show, we deal with everything from mothers who have had infertility and now breastfeeding is not going well, to mothers who've had underlying anxiety disorder and now having a baby just really brings out all that anxiety 100-fold.
Wow. Well, just that alone in sharing that information, Maya, just sounds like you've just reached a whole new level in treating our moms, and you know, that collaborative sort of care sounds like it's really working well for you. Interesting you say that you got that grant 10 years ago, and here we are at Gold, we're talking about our 10-year history. So I'm excited to share with our listening audience today that at our Gold Lactation Online Conference, we're celebrating our 10th anniversary. So it will be a big celebration as well this year, and we're glad, of course, that Maya has been able to join us. But Maya, why don't you reflect for us a little bit about your career and the changes that you've seen in the lactation field over the past 10 years?
I definitely think that when I started, we were really just even trying to advocate for mothers to breastfeed in public. And now I feel like there is a lot more awareness that it's not even just about advocating for those kinds of things. We really do need to be advocates in terms of getting them help in the first few weeks of life. I always try to tell moms that if I could see every baby in the first week of life, I think I probably could fix 99% of the problems. Fortunately, I think for us locally here and in our state, most of the birth hospitals are starting to realize it's not only the support that we get as part of Baby Friendly and in the hospital, but that Baby Friendly sort of spirit needs to spill over into the outpatient follow-up. Because those stays are still so brief, and often some of these problems sort of happen after they've had the birth experience. So we help moms also just with trying to process what just happened to them in the hospital and everything that goes with that, all their life changes, and how this is just the most dramatic thing that mostly has happened to a mother and a father ever in their lives. So I think I definitely have seen that change. I feel like it's really beautiful to be doing breastfeeding support now in 2016. It was much more challenging to do it 10 years ago.
Well, I'm sure that with your trifecta approach too, that you've, seen that grow, just in learning how to cooperate with each other as well. And so again, it takes it right back to it's so much more than just the latch. So it's really exciting to hear how successful you've been in that area. Well, for my final question I have for you today, Maya, I want you to think of something to share with our audience without giving too much away. So we want them to come to this wonderful presentation. So, but what are you really most looking forward to sharing with your audience?
I feel like we have there are definitely certain diagnoses that are more challenging for those of us helping moms with breastfeeding, and certainly crying and the fussy baby are on the forefront of that. I think most parents have a really hard time adjusting to what is sort of normal baby crying, and it often can really sort of sabotage breastfeeding. Just when breastfeeding is getting established, that's when babies start to have their normal fussiness. And so I'm hoping I'm going to be able to give some strategies around that and really how to support, I guess, again, the whole family around how to make breastfeeding successful in the context of what is normal baby fussiness.
Okay, well, that's awesome. Well, we are looking forward to hearing more. Some of those challenges they go so deep with our moms, and again, having this type of care seems to be the much more effective approach as well. Well, thank you for sitting down with us today, Maya. It's been fun having you here and just learning a little bit more about yourself and your up-and-coming presentation here as our keynote presenter for our Gold Lactation Online Conference, again titled A Trifecta Approach to Supporting Breastfeeding. It's so much more than just the latch. So we look forward to having anyone. Just as a reminder, our Gold keynote presentation will be on April 11th at 1700 and 2200 GMT time. So be sure to join in to our listening audience. Thank you again, Maya, for being here with us. It's been lovely having you.
Thank you so much. We look forward to next month.
Yes, and we do too. Thanks again, everyone, and have a great rest of your day. Bye-bye for now.